OSF HealthCare System and Rockford Health System have signed a non-binding letter of intent that could result in Rockford Health System becoming part of OSF HealthCare System. This announcement marks the start of a due diligence process that we expect will culminate in a decision one way or another this fall. If the transaction is completed, and there's a lot of work to be done and a lot of regulatory requirements to be satisfied, the City of Rockford's two oldest hospitals, Rockford Memorial Hospital and OSF St. Anthony Medical Center, will become OSF HealthCare's Northern Illinois and Southern Wisconsin region. Included in the acquisition, along with Rockford Memorial Hospital, would be Rockford Health Physicians and the Visiting Nurses Association. The Rockford Memorial Development Foundation would remain independent. So why come together at this point in time? The bottom line, this is about doing whatever we can to ensure that residents in this region continue to have the highest quality, most advanced health care close to home. This decision is based upon a desire to do the right thing for patients and families. As healthcare providers, we do have a significant responsibility to look beyond today and into the future. All of you know our challenges. They are the same challenges that healthcare organizations are facing across the country. With national healthcare reform, shrinking reimbursements, and a struggling local economy here, we know we will have to do business differently. It's time to take a look and develop a new business model. Collaboration will be at the forefront of that model. We believe that by combining the talents, technology, and facilities of our two exceptional healthcare delivery systems, we would be positioning Rockford as a regional destination for outstanding medical care. We also believe if the collaboration becomes a reality, it will serve as a significant boost and an economic engine for our local economy. For those of you who may not know it, OSF HealthCare System is based in Peoria and is owned by the Sisters of the Third Order of St. Francis. Among other things, the system currently operates 7 acute care hospitals in Illinois and Michigan, one, of course, being our local OSF St. Anthony Medical Center. In the true spirit of collaboration, OSF HealthCare System has agreed to a new model for the proposed Northern Illinois and Southern Wisconsin region. It includes having a local governing board of directors who would oversee the day-to-day Rockford-based operations and be responsible for physician credentialing, privileging, and other issues of the medical staff. We believe local governance is extremely important. And now it is my pleasure to introduce Mr. David Schertz, the President and CEO of OSF St. Anthony Medical Center. Dave? All yours.
Thank you, everybody. As Gary alluded, the times are changing, and quite frankly, this past year has been a time of significant change in healthcare. As we delve into the contents of the healthcare legislation recently passed, it's become obvious to both our organizations that strength in numbers will be needed to adapt to and provide the highest quality care under these new guidelines. We think our two organizations, as we look at each other, as we look at our quality data, we have some very significant accomplishments to talk about as two independent organizations. But coming together, working on best practices, combining the knowledge of two large organizations, we think we can advance the quality in this region dramatically. I think another important point to make in terms of looking at the future, a lot of thresholds are being set for centers of excellence. In other words, volume is an indicator of quality also. It's been proven again and again and again that the more you do something, the more you learn, the better you get. So when we look at our two programs working together, we start to cross some real thresholds in terms of setting up a new definition for center of excellence. And then finally, it is about Rockford and this region in terms of our competitive position going forward. Our competition is not so much a local phenomenon as it is a regional phenomenon. And the size of this new organization, the resources we can bring together, will allow us to effectively compete against our new competitors. Chicago, Milwaukee, Madison. So we're very excited about this. We think there are so many great opportunities to be achieved, and we're really looking forward to the future. So with that, I'd like to introduce Paul Green, the Chairman of the Board of Rockford Health System.
Thank you, David. I just have a few very brief prepared comments. As Chairman of the Board of Rockford Health System, my role, along with my fellow board members, is to look out for the best interests of Rockford Health System, physicians, the employees, the patients, and our community. When we look back over the last year and think about all the changes that are proposed for healthcare, three words consistently come to mind: quality, access, and cost. As board members, we have spent a great deal of time studying how best to accomplish our goals in each of these areas. After careful thought and weighing all our options, we believe this collaboration offers great potential and opportunity to achieve our goals. Although there's a lot of work to do, if we can bring OSF HealthCare and Rockford Health System together, we're convinced this combination of two great healthcare organizations will improve quality at an even faster pace than we will individually. We believe we can improve access and make real progress in reducing the cost of healthcare to Rockford and the surrounding community. Thanks very much. Gary?
Thank you. I'd like to now introduce Mr. Jim Moore, CEO of OSF HealthCare. Jim?
Thank you, Gary.
All yours.
Good morning, everyone. Thank you for being here. It's a very special day, we believe. It's a day not about what's not possible, but about what is possible. We believe by the coming together of these two organizations, because they choose to come together, not because they have to come together, it opens up a world of possibilities about the future of healthcare, access to healthcare, the quality of healthcare, and the scope and breadth of services of healthcare that will be possible going forward. And that's what's driving these two organizations. It is a common vision about the possibilities for Northern Illinois and the healthcare delivery system there that makes this an exciting thing. I think it also gives a high probability of success because we share this common vision. We're not driven here by financial reasons. We're driven by a common vision of excitement about the possibilities. As you've heard, we do believe this coming together creates, if you will, a very strong medical infrastructure going forward in this community in Northern Illinois, which we believe also then underlines the possibility for overall economic growth, because a strong medical infrastructure coming together, helping to, in essence, manage the cost of health care, makes it an attractive vehicle for economic development across the whole community, not just the two organizations. So from that standpoint, we believe it is a very, very possible thing. We also believe by, and Dave alluded to this, by coming together in the volumes and what you can do, believe that the role of medical education in this community, by working together with the School of Medicine, the strength of the two organizations come together can also be enhanced. So we look at this across a broad measure of opportunities available to us as two organizations coming together, functioning as one, versus individually, which has been taking place in this particular marketplace. So we're very excited about this, but we're more excited about the potential that exists through this joint effort of the two organizations in this coming together. So thank you very much.